Hi there, welcome to the virtual Autism Services orientation, where you can watch at your own leisure, pause, and restart again if you need to. Today's session is going to run for approximately 30 minutes. My name is Chantal Patterson, and I am part of the Autism Services team here at Strides Toronto. So today I'm going to share some information about our agency. We'll take a look at what behavior therapy is, and I'm going to finish up by going through the programs offered through Autism Services. Just a quick read here, a disclaimer. So the information in this video is provided for information purposes only. It should not be used as a substitute for professional support or treatment. Now, Strides Toronto is the amalgamation of Aisling Discoveries and East Metro Youth Services, two agencies that have served children, youth, and families in East York, Scarborough, and beyond for more than 40 years. Our diverse services for mental health and overall well-being are flexible, responsive, culturally sensitive, and based on individual child, youth, and family needs. We work collaboratively, sharing knowledge and evaluating our work to achieve continuous improvement. We strive to provide the most comprehensive, responsive, and diverse supports for our clients and to be the leader in our sector. It is our privilege to serve our community. And just a little bit more information about us. Now, Strides Toronto is a children and adolescent mental health and addictions agency accredited by the Canadian Centre of Accreditation. We have been named the Toronto Lead Agency as part of the province's mental health strategy. So this is a plan designed to help children, youth, and families access mental health services in their communities. We are a not-for-profit agency proudly serving East Toronto and surrounding areas. We are flexible and considerate of individual and family needs. So we're going to align your goals, provide individualized assessments, and we're going to work with you to maximize your budget to develop your child's treatment goals. We believe that collaboration with families, communities, and the other service partners enhance the achievement of outcomes for the children, youth, and young adults we serve. And finally, our autism services are evaluated and monitored by Board Certified Behavioral Analysts, or BCBA. So rest assured that Strides Toronto have the qualifications, the expertise, and the experience. We are committed to our families and the high quality service that we have and will continue to deliver. So for the next few minutes, I'm going to provide a brief overview of just some of the services that Strides Toronto can offer. So just beginning with the consultation. So this would entail initial information gathering to determine appropriate services as to how to best support your family and meet your needs. We offer flexible, responsive counseling for children up to the ages of 12 and their families. It includes individual child therapy as well as trauma treatment services. So counseling may include parent coaching that helps parents create structure and routines for their children and teaches them effective behavior management strategies. Whereas our community counseling services focus on youth ages 12 to 18-year-olds and their families understand, overcome, and manage personal problems and or mental health issues. Our infant child treatment program strives to strengthen the healthy social and emotional development of infants and children in partnership with their families and communities. So we offer an array of group services, which ultimately aims to support, educate, and develop skills. So we offer a variety of parents-only groups, children-only groups, and also joint parent infant-child groups. So I'm going to highlight some of those skill development programs in a few minutes. So the adult group services aim to improve parents' understanding of themselves and their children, develop supportive relationships and networks, and to reduce stress and isolation in the community. Whereas our children's groups aim to improve children's understanding of themselves and as others, as well as to provide and improve social interaction skills in a group setting. Our trauma treatment services is a program that is goal-focused and is provided on a regular, predictable basis. It is designed specifically for children who have suffered severe trauma or show feelings of distress and would benefit from structured approaches to address specific behavioral symptoms. So the goal here is to improve the child's overall functioning. Our after-school programs. So we have a Galloway after-school program that offers socialization, life skills, and activities for teens and young children, young adults rather, diagnosed with autism spectrum disorder or a mild to moderate developmental challenge. Our Galloway Respite Program offers a range of accessible relief services for youth ages 12 to 24 with a developmental disability or autism spectrum disorder. The goal of these services is to provide quality and flexible family-centered programming that promotes the development of both social and life skills. Our residential program is offered to youth who are coping with an array of psychiatric, emotional, and/or behavioral challenges that interfere with their daily lives and can no longer live at home. Telemental health can be provided to youth up to age 18 and is offered in partnership with Sick Kids Hospital, the youth's mental health professionals and their family to access psychiatric support through video conferencing from a location that is most convenient. So under skills development, we have a number of goal-focused, evidence-based counseling groups, including the Triple P Positive Parenting Program, which aims to prevent behavioral, emotional, and developmental problems in children by enhancing the knowledge, skills, and confidence of parents. Facing Your Fears, which is a group aimed at addressing anxiety. Circle of Security, which focuses on the attachment between parents and young children. And a postpartum depression group that works with mothers and public health. Under our drop-in programs, we do have the Zone Youth Space, which allows a safe place for youth to come together to create, connect, learn, and to inspire. And we also offer a What's Up walk-in counseling service available 6 days a week. No appointment is necessary. And the clinic helps with a variety of issues, anywhere from depression and anxiety to sexual identity matters and anything else that might be on one's mind. Now, the What's Up Walk-in Clinic is a citywide effort and is made up of partnering agencies. Our day treatment program is designed for youth who are experiencing significant challenges in school. The program combines the Toronto District School Board's curriculum with therapy to help young people deal with a variety of issues, including mental health and the return to the regular school system. So as you can see, we do offer our programs at a variety of locations just to make it more convenient for our families. And more specifically, we do have 3 sites where we offer our behavioral intervention treatment program. So beginning here at our Milner and Progress location. We have a location off of McCowan on Middlefield, just between Shepherd and Finch. And we also have our Birchmount and Eglinton site. So let's begin by exploring what exactly is treatment. So I'm going to provide a very high level of what applied behavior analysis is. So ABA falls under the umbrella of psychology, and it's based on the science of learning and behavior. So ABA focuses on the things or the events before a behavior, and a behavior is classified as anything that we can see or that we can hear. And it also focuses on the events that come directly after the behavior. So the core of ABA is all reoccurring human behavior is maintained by events following that behavior. So by doing this, we can arrange the environment to either increase or to decrease behaviors. So some of the things we want to see more of course, are the social skills, the communication, the independence within daily living skills, and some of those behaviors we would like to see less of would be those maladaptive behaviors. So those behaviors that are getting in the way. So the aggression, the self-injurious behaviors, running away, just to name a few. So ABA is recognized as safe and effective treatment method for individuals with autism spectrum disorder and can be used to teach a wide range of skills in various domains. So one major component to ABA is data. Data is collected and it's monitored to identify, measure, and evaluate the effectiveness of the treatment, because otherwise, how else are we going to know if a treatment or an intervention is working? So some of the principles are going to be highlighted in the next clip. We have a very quick clip of a circle time. So let's take a peek. It's very quick, but it's good.
Who has pants? Me. Yay! Come with the pants. Right here. Good. Go sit down, Kevin. Good job. Who has mittens?
Okay, so what we saw here was a very quick clip of circle time using some principles of applied behavior analysis to teach sitting, to teach waiting, to teach attending to the teacher. We saw raising the hand, receptively identifying pictures between two photos, following directions. So a lot is happening in this video. So we have a teacher and we have a back prompter, and the back prompter is also serving as the data collector. So we're seeing a gestural prompt, and of course a prompt is a cue to increase the likelihood that our children will demonstrate a correct response. We don't want them to be practicing errors. We saw reinforcement provided as well, which is key to teaching any skill or behavior. Now, for some children, some or all of these skills may have been needed to be taught in isolation before joining the group. So far I provided a very brief overview of applied behavior analysis and some of the strategies involved in behavior therapy, but another component to your child's treatment involves parent education. So in fact, research has shown that children who receive 1 hour of parent training per week made similar gains as children who received 5 hours per week from a specialist. You can become an expert by attending our workshops, consultation and coaching, which I'll highlight in a few minutes. And we also have the mediator training model. And this is where a therapist teaches the parent the strategies, and the parents then implement the strategies with their child. And this is going to promote your child's maintenance and generalization of skills being learned during therapy. So the workshops that we do offer include an introduction to autism spectrum disorder. And this is where we talk about how the brain of an individual affected by autism differs from a neurotypically developing brain. So understanding these differences is going to have an impact on our teaching. We offer a key term session, and this is going to provide an overview of some of the terms that are effective for teaching individuals with autism, like the prompting and the reinforcement that we just saw in the circle time video. We also talk about task analysis. Next, we have our building ABA into routines, and this is how we are going to embed those key terms into our everyday routines. And lastly, we have our prevention and redirection. So during this session, we talk about how all challenging behavior happens for a reason. And although that reason may not be very clear, your child is engaging in this behavior to communicate something, to meet a specific need. So there is a purpose. So this workshop is going to offer families antecedent strategies to promote success and to prevent challenging behavior. So just to discuss the further benefits of parent education. Now, we do recognize that parent education and training, it does take time and it's not intended to be overwhelming. Now, once you become comfortable with these strategies, they will become second nature, and you're soon going to realize the amount of teaching opportunities in your home and virtually everywhere and anywhere are countless. So at home, many teachable moments occur that just don't present themselves at the center. Like there's no way we could replicate a bedtime or a bath time routine. So parent training allows you to make the most of these moments in natural occurring environments. So you can learn to implement these strategies with confidence just as well as any therapist, and you can also teach other family members these strategies. So this allows you to increase the number of intervention your child receives in their day, so it also makes it more cost effective. So research has also shown that parents who participate in parent training report more optimism about their own ability to influence their child's development and decrease parent stress levels. So knowledge is power. The more that you know, the more confident and relaxed you can feel to work with your child when new behaviors arise. And also teaching more independence allows for more leisure time for caregivers at the end of the day. So we are part of many communities. We are part of a parenting community. Some of us may be a part of a religious community. We have our geographical community. So you're also part of a community of having a child with autism. So coming to parent education sessions really allows you to make connections with other family members that may be going through similar experiences such as yourself, therefore offering social support. So this one is I mean, they're all fantastic. That's one of my favorites. Okay, so before we get into our autism programs, I did want to explore, I did want to inform you on a couple of things in which you can expect. So before having your child participate in behavior therapy, an intake worker will complete an intake needs assessment using the CANS, or the Child and Adolescent Needs and Strengths tool. Now, this is going to identify your child's skill or learner level across various domains. So based on the results of the assessment and your goals for treatment, your child will be provided with a clinical recommendation. Now, the assessments don't just end there. Now, during the first few treatment sessions, your child's behavioral therapist is going to complete an initial assessment. And this is going to involve collecting baseline data. And they're going to also consult with you. And together, this is going to inform treatment goals. So upon completion of your child's treatment, you are going to receive a final report. And this report is going to outline your child's next recommendation, and it's also going to offer you strategies to promote that maintenance and generalization of skills learned during their treatment sessions. Okay, so now we're going to explore our behavioral intervention service offering. So just a quick reminder that all of the programs that I'm going to highlight can be found at www.autismhelp.ca. So just click on download our autism services catalog and they're all going to be there. Okay, so we do offer 3 streams of behavior treatment programs. We have our individual consultation and focused behavior service offered to children and youth 0 to 18. And we have our early behavioral intervention offered to children 0 to 6 years. So within each stream, we have many different programs. So let's take a peek at our first one here. So individual consultation. So this would be appropriate for families who wish to receive individual support to target a specific concern. So this service would take place where it most makes sense. So it may take place in your home or in the community or in the center. So what's great about this service is that parents continue to have access to a behavior therapist 3 months post-treatment to target or to fine-tune any sort of concerns related to that behavior that may arise. So individual consultation can be offered for 6 sessions or for 12 sessions. We have our parent training for disruptive behaviors, the Ruby Training Autism Network. And so this program focuses mainly on parent training and implementation. Some challenges addressed during the Ruby program could be those tantrums or non-compliance, difficulties with transition or aggression, just to name a few. So now we're going to highlight the programs offered within our early behavioral intervention stream. So these programs would be appropriate for children 0 to 6. When I say 6 years old, developmentally 6. Okay, so let's just begin with improving parents as communication teachers, or the IMPACT program. So with good intentions, we as adults can sometimes turn that play into work. So we might be asking a lot of questions, or We might be, you know, we might already have sort of a plan in our mind as to how to direct that play. So unfortunately, that's where we might see our children turning away or wandering off. They're just not interested. Play for adults is hard. Play for kids is also hard. But play is really hard. So what's fantastic about this program is that it is offered for 12 sessions. Now, 6 sessions will have parents join us in class, and the other 6 sessions will offer individual coaching sessions with you and your child and a behavior therapist. And so you're going to be coached on the information that was provided from the previous week. The impact program focuses on teaching your child social engagement, imitation, and play skills. We have our early social communication program, which is co-led with a behavior therapist and a speech and language pathologist using a combination of applied behavior analysis and speech and language pathology approaches. So it's the best of both worlds. Now this program involves homework and coaching, and it can also be offered to children who are demonstrating signs of autism. So sometimes we may get referrals from speech and language pathologists. So this program is offered for 12 weeks at 2-hour sessions once a week. Our Learning to Play program focuses on the development of play, so both solitary and parallel play, which is the foundation of social skill development. Now, this program also involves parent participation with homework and coaching, and can also be provided to children who are demonstrating signs of autism. So again, this program is offered for 12 weeks, 2-hour sessions, once a week. Next, we have our early behavioral intervention, or EBI for short. Now, many of you may know this program as IBI previously. So this would be appropriate for learners that require intensive teaching across many domains. So perhaps the communication, learner readiness, management of challenging behaviors, independence within daily living skills. So this program is primarily one-to-one. However, there are opportunities for group participation. This service is offered 5 days a week between 15 and 30 hours. So it's quite intensive, and it can be available between 3 and 6 months at a time. Our Time for School program is offered as a small ratioed group for children approaching school age who need readiness and transition support to promote a successful school experience. So this program is going to focus on play and social skills and communication, pre-academics, and of course circle time. So this service is offered 5 days a week for 15 hours for 12 weeks. So moving on to our focused behavioral services. Now, these programs are offered between 2 to 4 hours a week, so less intense than the couple other programs that we just talked about. And all of these programs are offered for 12 weeks. We do offer our services between Mondays and Saturdays at different times. So we do have programming in the morning, in the afternoon, and also in the evening. So the latest session that would begin would begin either at 5:30 or 6. So that would bring us to 7:30 or 8 p.m. So each of these treatment groups would be a prerequisite for the next program. So let's take a peek at our Introduction to Communication. So this program works to establish a formal and consistent communication system to ask for desired items. So whether it's through the picture exchange communication system, pointing, or vocal requests. Now, a key component to the Introduction to Communication program is parent training. So again, we really want to give you the tools so that way you can really keep that learning going once you leave our center. So this program is offered twice a week for 1 hour per session. Our Social Communication 1 program is offered to children and youth with some early communication skills. Now, this program aims to increase the complexity of their communication in terms of the requesting and the labeling and responding to others. This program is offered twice a week for 4 hours. Our Social Communication 2 program would be appropriate for learners to develop conversational skills. Now, some goals include initiating and maintaining play and answering WH questions. So we've got the who, what, where, when, why type questions. This program is offered once a week for 2 hours. Next, we have our children's friendship training, and this one is offered to motivated children ages 7 to 12 years. Now, children attending this program must be interested in attending. Now, some of the areas of focus include how to join a conversation, how to handle rejection, how to be a good sport. So with this social skills program, there is a parent education series that will teach you how to assist your child in making and keeping friends. So this program is offered once a week for 2 hours. Next, we have our Peers Modified program, and this is offered to youth in grades 7 to 12. And the focus of this program is to develop complex social skills. So this program is a developmental extension from the Children's Friendship Training program that we just talked about. Now, in addition to some of the goals that you see here, other topics of instruction include how to handle teasing and bullying, how to handle rumors and gossip, so those critical social skills that teenagers need. This program is offered once a week for 2 hours. Next, we have our Preparing for Adulthood programs, and this would be offered to teenagers to promote their independence, whether it's in the community or in the home. So we have a community safety program where teens spend some time planning TTC routes and taking the public transit independently as the end goal. So of course, the therapist is shadowing close by. We also have a component that focuses on money management. Our employment and volunteering program focuses on resume writing and preparing for that job interview. There's also a Best Foot Forward Working Together program, which focuses on perspective taking and adapting working in a group. So definitely a skill required for employment. Now, all of our Preparing for Adulthood programs are offered for 2 hours once a week. And finally, the last program that I do want to highlight, which I did briefly mention earlier today, is the Facing Your Fears program. So Facing Your Fears focuses on the reduction of anxiety symptoms in children with high-functioning autism spectrum disorder using a cognitive behavioral therapy approach, or CBT. Now, CBT is considered to be best practice. CBT focuses on changing thoughts that ultimately influences emotions, which translates into behavior. So Facing Your Fears is going to allow your child to gradually face anxiety-provoking situations that were once avoided. So this is a 14-week parent and child group offered once a week for 1.5 hours. So there you have it. I hope you found today's orientation session helpful. If you have any questions about any of the programs, or if you would like to find out more information as to how Strides Toronto can support your family, please do not hesitate to give us a call or send an email, or you can always visit us on our website, as there are additional programs that I didn't quite highlight. Now, please don't forget to follow us on our social media pages here. But thank you so much for your time, and we hope to hear from you soon. Thank you.